This time, it's religious leaders stepping out to lend support in the fight to keep St. Michael's Medical Center open in Newark.
This is a moral issue. This is a moral issue.
The state-commissioned Navigant study has recommended that St. Michael's restructure as an outpatient ambulatory center. But St. Michael's is countering that report with one of its own after hospital management says Navigant used faulty data.
When you do a deeper dive into the information that is there, some of what you'll find is the information that they used may have been incorrect, may have been from a wrong year.
All of you that work in healthcare realize that when persons do not have choices, that means it drives up the cost of healthcare for everyone. St. Michael's is already receiving persons that are undeserved, underprivileged of our particular city.
St. Michael's CEO says the Navigant recommendations would create a monopoly in inpatient hospital services in the Newark area, potentially driving prices to increase by as much as $180 million annually, and that it would drive thousands of Newark residents to seek patient care outside the city. Navigant consulting firm did not return our request for comment about St. Michael's report.
Our patients are coming from areas that choose to come to St. Michael's. They could have been going to university already, they could have been going to Beth Israel already, or they could have been going to Clara Moss already.
Big university programs sometimes can be overwhelming and less personal, whereas our residents have personal contact from the emergency room to the floors, to either the medical clinics or to the doctor's offices.
This is an issue about justice in the inner cities and the right for choice of where we want to have health care and who we want to have health care with.
The support from the community to save St. Michael's has been evident from the start, and neighbors say that's because they're still dealing with the changes that happened in 2008 when nearby St. James and Columbus hospitals closed, and because more than 1,000 jobs are at risk.
They're the two most recent examples of this notion of an ambulatory care center with an emergency room, satellite emergency department, having failed.
Can you imagine 1,400 persons without jobs? 300 are residents of the city of Newark. 700 are residents of Essex County.
The state-owned University Hospital would become the biggest game in town if Navigant's recommendations go through. The sale of St. Michael's to the California for-profit company Prime Healthcare is awaiting approval from the state attorney general. Supporters say it's their last hope. The hospital's CEO is awaiting details on a hearing in front of the State Health Planning Board. In Newark, I'm Brianna Venozzi, NJTV News.